Good afternoon. Here we are in beautiful Lake Buena Vista, Orlando, Florida. We're looking at one of the 4 contiguous lakes. I'm Jack Krause for DentalXP.com. Today we're having an interview with an international colleague of ours, Dr. Ziv Mazor from Ra'anana, Israel. Welcome, Ziv, to our conference here. Why don't you tell us a little bit about yourself, your training, and what kind of a practice you have in Israel, and tell us some of your background.
Well, I'm a periodontist, and I was graduated in Hadassah, Jerusalem, Dental Medicine School. I was serving in the Department of Periodontics for 4 years, both in Jerusalem and the University of Tel Aviv. Later on, I moved to my private practice in Ra'anana, and my private practice, we do mostly implant dentistry, both surgery and prosthetics. I'm engaged in a lot of teaching, both nationally and internationally. I was also the president of the Israeli Perio Society, and as you can see, I'm quite busy.
Well, that's to say it mildly. I know your work over the years, particularly in the areas of sinus augmentation, implant designs, incorporating various biomaterials. You've really contributed a lot to the literature. Can we talk a little bit about your series of sinus projects where you've given us in the field a lot of information on the amount of bone that's required for simultaneous? I think that was quite a dramatic addition to our body of knowledge.
Yeah, well, as you see, as you know, we like to push the limit a little bit. And we started back at the early 90s to perform the sinus lifts, which were at the beginning. And we were trying to do and place all the implants simultaneously at the same time in order, first, to save time, and second, to save the patient an additional surgery. And throughout the years, we have developed our system and our treatment modality that we really do not require the amount of bone that was advocated for us in the literature. It was advocated that we need at least 4 to 5 millimeters, but we have shown time after time again in several articles that were published both in the Journal of Periodontology and the iGeomy that even in those cases of 1 to 2 millimeters, we still can do our implants simultaneously following our guidelines.
Well, I'd like to ask you about some biomaterials. How much on the biomaterials do you think contribute to the successes of those cases versus your well-thought-out surgical protocols and techniques in these areas?
Well, in my own opinion, I think that the surgical technique is even much more important than the grafting material itself. But of course, we always prefer to use grafting materials that will turn and remodel into new bone. That's why we prefer to use either allografts or alloplasts like beta TCP that will transform into new bone.
I've seen some of your work using the bone cements. Could you comment on that a little bit for us?
Well, that was quite a very interesting point, because during my research and search for new grafting materials, I got to a conversation with a friend of mine, which was a neurosurgeon, and he told me about those materials that they use for repairing skull defects. So that's how I came to this material, which is like an hydroxyapatite bone cement that I placed in the sinus and placed implants at the same time. And this project has been going on for the last 8 years, and we got very good success.
Yeah, we'll be looking forward to some more data on that type of material, because as a cement, does it actually harden in the sinus as a cement, or it's...
Yeah, as a matter of fact, it hardens as a rock, and it's very, very difficult to drill this type of cement, and it doesn't get resolved. I mean, our results through the years show us that the cement is still there.
Well, perhaps at an updated interview, you'll tell us how the biological effects actually take place in the vascularity going through the bone cement. But that's fantastic. How do you teach these techniques at your home in Israel and abroad? I know with the international conferences like we have here, you're often on the main podium delivering your updated information. Do you run courses back home?
Well, we run courses back home, and also we run courses for international groups. And as a matter of fact, we run, I think, one of the, or maybe the only place that I know of, maybe there are some others, that we do also hands-on live patient courses. And we run those courses in Romania for very small groups that would like to have the experience and the confidence of doing those surgical techniques.
Well, if I could get a license, and if you could help me get a license, I would be happy to be your assistant surgeon at these courses. But I know it's a little tricky for the American colleagues.
Look, for you, Jack, anything.
Okay. Are you having any conferences coming up in the near future? I know you're oftentimes involved in scientific committees and organizing committees. Well,
the two main scientific meetings that I'm going to be the chairman are first the IAOI, which is the Israeli Association for Oral Implants, and that's going to be in Eilat, which is on the Red Sea. It's a resort, and this is going to be taking place in November 2007 between the 7th and the 8th and the 10th, and I welcome all of you who would like to attend this meeting. And there is another big international meeting which is going to be in May 17 to 20 in Berlin, Germany in 2008.
Well, you're truly a Renaissance man, keeping very, very busy. So on behalf of DentalXP.com, we thank Dr. Ziv Mazor for joining us today, and we're looking forward to his presentation. Thanks, Ziv.
Thank you.